Jai Hind to all. Welcome to the day 9 of National Webinar Series. On behalf of Samarpan Group, it's my honor to introduce our today's speaker, Mrs. Manisha Vincent Ma'am. Ma'am is currently working as an assistant professor in Samarpan Institute of Nursing and Paramedical Sciences, Lucknow. Ma'am previously worked as nursing tutor at Arias College of Nursing and a University, Lucknow since 2014, bringing 10 years of continuous teaching experience. She holds a master's degree in medical surgical nursing from VIPS College of Nursing, Gwalior, with distinction level academic performance. She earned her Bachelor of Science in Nursing from Sahara College of Nursing, which is affiliated with KGMU in Lucknow. Also completed a certified infection control nurse course from Era College of Nursing in 2019. Her research work includes a BSc group project on accident prevention at Ram Manohar Lohia Hospital, Lucknow, and a master's dissertation on pulmonary tuberculosis prevention, which has been published in the International Journal of Scientific Development and Research. She has attended and contributed to workshops on infection prevention and control, emergency care and trauma management, clinical skill evaluation via OSCE and OSPE.
Yes, ma'am. You can start your PPT now.
A very good afternoon to all of you. I would like to say thanks to Principal Ma'am, our colleagues. Especially, I will give thanks to Medical Surgical Department as they are going to give me this privilege to present the communicable diseases in front of you. I would like to thank Shashank sir and Manisha ma'am for giving me this opportunity to present the communicable diseases. So without delaying the topic, I would like to present my slides. So about communicable diseases, the diseases that can be transmitted from one person to another are termed as a communicable diseases. Communicable diseases are as follows: as illness of the infections, nature that can be spread from one person to another. It is a kind of disease which can spread from one person to another persons. What are the assessment of communicable diseases? There are three components we will use in the assessment of communicable diseases. The one is history taking, second is clinical examination, and diagnostic evaluation. So in history taking, while history taking, following informations are collected from the patient, his or her family members, identification data, present illness, past illness, family history, personal history. These all are undercome in the history taking. Health status, what are the mode of delivery? These all are undercome in the history taking. And in physical examination, while assessing communicable diseases, one and more following physical examination techniques are used as per the requirements are inspection, palpation, percussion, auscultation. During physical examination, following informations are collected: vital sign, color of the skin, cyanosis, pallor, presence of any abnormal mark on the skin, appearance of skin rashes, uh, auscultation or breathe sound. And the last one is diagnostic evaluation. In diagnostic evaluation, the laboratory tests are performed.
Ma'am,
I think there have been some issues
okay,
related to
I'll
the
I'll I'll share the PPT.
network. Yeah, please. So these are the three techniques which are used in the assessment. Now come to the infection and its transmissions. Infection. What is infection? Entry of any pathogenic microorganism in the
Hello? Excuse me, ma'am, you are not audible. Student participants, there is some network issue. Kindly wait.
Okay. Source of infections. As for the source of infections, man himself, animals, insects, soil, foods, and waters are, these all are the source of infections of the transmission. So, mode of disease transmission. The mode of disease transmissions will be divided into two parts. The one is direct transmission and the second is indirect transmissions. In direct transmissions, through direct contact, droplet infections, transplacental, these all are undercome in the transmissions. And about the indirect transmissions, the fometile, vector-borne, airborne, these all undercome the indirect transmissions. About the respiratory infections, in respiratory infections, we have these diseases. So first of all, we'll deal with measles, chickenpox. So it is also known as a varicella zoster. Uh, it is an acute viral infection. Mainly it occurs in the children's below 10 to above years, below the 10 years of age. And one attack generally acquires immunity for the rest of the life. And about the incubation period, okay, mode of transmission. The mode of transmission, it is transmitted by the droplet nuclei and droplet infections. It can be transmitted by personal contact or the person who is infected through which the placental burial contact, they may get the infection easily. The sign and symptoms of the zoster is mild fever, itching, rashes. The rashes started from the trunk, face, limbs, and the abdomen. Prevention and control. About the prevention and control, isolate the patient as per the guidelines. We have to isolate the patients and will provide the immunoglobulins, antiviral drugs, and varicella zoster immunoglobulin 1 mg will give by intramuscular within 72 hours of the exposure. There is no specific treatment for the chickenpox. And important notice for the patients, they have to stop spread of germs that make you other sick. Like we have to give health educations that if they cough, sneeze, fever, cold, so they might isolate their self, clean their hands with alcohol-based hand sanitizers when you arrive, and before you leave after coughing or sneezing, you have to do hand washings. Measles. Now, second is measles. It is one of the commonest infection disease of children up to 6 years of age. One attack gives a high degree of immunity for the whole life. The mother who had an attack of measles imparts immunity to her infants for the first 6 months of age. The positive agent is RNA, paramoxil virus, and direct person to person through droplet infections, sneezing, talking, coughing. So these are the direct contact which will patient may get the infections. Infective materials is secretions from nose, throat, and respiratory tract infections. The incubation period is 10 to 14 days, and the sign and symptoms are high-grade fever, sneezing, watery eyes, conjunctivitis, coughing. Prevention and control of measles. See, prevention and control of measles is undercome the measles vaccines. It is given at 9 months of age. Dose is 0.5 ml, and route of administration is subcutaneous. Subcutaneous injections. It is a live attenuated vaccines, MMR vaccines, which is measles, mumps, rubella. It is given 15 to 18 months of age. And route is subcutaneous route. The dose is 0.5 ml and measures isolate of the infected child. The child should be immunized with immunoglobulin within 3 to 4 days after exposure. Secretion from the nose and throat are the main effective materials. So these should be discarded properly. Health education to the people regarding cause of the disease, mode of transmission, clinical features, preventive measures, controls. What are the treatment of measles? Immunoglobulin within 3 to 4 days of exposure. Post-exposure measles vaccinations, it should be administered within 3 days after exposure in non-immunized children. Antipyretics such as acetaminophen will be given, ibuprofen will be given, antibiotic therapies will be provided, adequate bed rest, proper nutrition. These are the prevention and control of the disease points. Now come to diphtheria. Diphtheria is a bacterial disease which caused by the Cyanobacterium diphtheria. It is an acute infectious disease where it produces a grayish white false membrane of a soluble exotoxin. If that membrane spreads to the air passage, it may block entry of air and cause difficulty of breathing. This disease mainly affects upper respiratory tract. Sore throat is its main. These are brief describing the clinical features. It is widely distributed disease and affects person of all ages, but children in the age of 3 to 5 years are more affected. What are the causative agents? I earlier explained about the Cyanobacterium diphtheria is the causative agent. It is spread by droplet infection and through carriers and patients. Mode of transmission. Handling of vomitiles contaminated by nasal or throat secretions can be transmitted the disease. It can also spread by sneezing, coughing, spleeting. So these are the causative agents, transmissions of the disease. Incubation period of diphtheria is 2 to 5 days or then longer. The sign and symptoms is toxemia, difficulty in swallowing, patches of grayish yellow membrane over tonsils and throat. Fever, sometimes patient is having fever, pain, swelling. Preventions. What are the prevention and control of the diphtheria? The first prevention is immunization. DPT vaccines 0.5 ml at the age of 2, 4 and 6 months. A booster dose can be given at 1.5 year and 5 year of DT, yani ki diphtheria vaccine is given. Isolation of the patient at home or hospital in a well-ventilated room. And good personal hygiene should be maintained. Effort should be made to detect diphtheria carriers early, as early possible to detect the diphtheria. What are the treatment of diphtheria? In diphtheria, will give the administer diphtheria antitoxin by IM or IV route. Dose is to 20,000 to 1 lakh unit. It is given after sensitivity test. Antibiotic therapy such as benzyl penicillin, maintenance of airway and breathing pattern, administer artificial oxygen is required. Tracheostomy if required. Closely monitor the patient for associated complications. Whooping cough. It is also known as pertussis. It is highly infectious disease of the lower respiratory tract that affect the trachea, bronchi, and bronchioles. It occurs in all ages, but most common in children under 5 years of age. It is dangerous if it infects under 6 months of age. Females are more affected than the males. What are the positive agents? The agent is Bordetella pertussis. Mode of transmission is it spreads directly by droplet infection or indirectly by fomites, contaminated nasal buccal secretions. The germs are spread into the air during talking, sneezing, coughing by the patient. Incubation period is 7 to 14 days. The more risk factors are pregnant women, babies, contact with the case, weakened immune system, warning immunities, the elder. These are the persons who catches this disease easily. Sign and symptoms. Slight fever, sometimes it shows, sometimes it's fluctuate. Running nose, whooping sound while coughing, and cathedral, paroxysmal, and consolvalent stage. These are the stages where the disease growing. These are the 3 stages where the disease are growing. In cathedral stage is the first stage of the disease that lasts for 5 to 10 days. During this stage, following features are found like patient is having fever, lacrimation, anorexia, coughing. Coughing, it is an irritating cough which is worsen at night, especially at night. The person is having worse coughing. Paroxysmal stages, it is the second stage of the disease. It is characterized by bouts of cough. The cough is explosive manner. It is duration is 2 to 4 weeks of the, and the last is convalescent stage. It is third stage of the disease. The duration is 10 to 12 days. During this stage, the child starts to recover from the disease and regains health. The preventions will be come under during cathedral stage. Antibiotic therapies such as erythromycin is given. Cough suppressant, the suppress cough, maintenance of nutritional level and hydration level. Infants are protected from exposure to this disease. Isolate the patient, disinfect the nasal and buccal discharges of the patient, provide the antibiotics, disinfectant, the formalities of the patient, cough preparations and antibiotics can be given. Affect the children should not allow to go to school for period of 6 weeks. At least 6 weeks they will not go to the schools for during the disease condition. Now, second is next disease is tuberculosis. Everyone is aware about the tuberculosis disease. It is a very common disease. It is chronic infectious disease of the lungs caused by the microbacterium tuberculosis. It is more common in developing countries. Primary, it affects the lungs and causes primary tuberculosis. It can also affect the intestine, meninges of the brain, bones, joints, lymph glands, skins, etc. It can occur at any age, but more common in older age than in younger ages. More common in malnourished people, poor hygiene condition, those who live in the overcrowded places. The positive agent is Mycobacterium tuberculosis. It is an acid-fast aerobic rod that grows slowly and is sensitive to heat and ultraviolet lights. Mode of transmission. By inhaling fine dust particles containing tubercle bacilli, by handling sputum and other discharges of the tubercle patients, by direct contact with the patient, by consuming food and drinks contaminated with tubercle bacilli, by consuming milk derived from a cow or buffalo suffering from the tuberculosis, and flies can also transmit the infection by contaminating the foods. Incubation period is a few months to years. It's depend upon the condition of the patient and also depends upon the medication. If the patient is taking proper medication on time, will cover up as soon. What are the signs and symptoms? Excessive fatigue, evening rise in temperature. The temperatures rise, evening, chest pain, loss of weight, chronic cough, blood is present in the sputum. Prevention and control. Keep the patient in well-ventilated house. Health education should be provided to the patient. Advise a proper balanced diet. High proteinous diet should be given to the patient. People should be educated not to spit here and there. Milk should be consumed after proper boiling. If maintain personal hygiene. Specific measures. Tuberculosis patient should be detected as early as possible by doing a sputum examination. The infected person should be isolated. The patient should not be allowed to spit. While coughing or taking, patient should wear a mask, face mask, keep a handkerchief before his mouth while coughing. Prevention immunization by the BCG vaccines can be given to the newborn below 4 years of age. Anti-tubercle drugs. There are two types of anti-tubercle drugs are present, first-line drugs and second-line drugs. In first-line drugs, isoniazid, rifampicillin, pyrazinamide, ethambutol, and streptomycin. These are the drugs which will provide in the first-line drugs. And in the second-line drugs, thioacetozone, ethanomide, cycloserine, kinamycin, capreomycin, amikacin. These are the second-line drugs which will be provided to the patient. If the patient is resistant from the first-line drugs, then the second-line drugs will be provided to the patient. Dosage of drugs are isoniazid is 600 mg, rifampicillin 400 mg, pyrazinamide is 1500 mg, ethambutol is 1200 mg, streptomycin will be given 750 mg. Advantages of DOTS. The client is supported to complete the full course of medications. The client is monitored closely for side effects of medications and supported to work through the side effects appropriately. The client is encouraged and support to complete required checkup, blood work, check, chest x-rays, etc. Reduce the possibility of TB germs becoming resistant to the medications. Rubella. It is also known as German measles. It is an acute childhood infection, usually mild, lasting for 3 days. Infection in early pregnancy may cause abnormalities or even death to the fetus. Causative agent is rubella virus. Mode of transmission is person to person by droplet infection from nose, throat, droplet nuclei in the form of aerosols. Incubation period is 2 to 3 weeks. Sign and symptoms. Low-grade fever, minutes, discrete pinkish macular rashes. Rashes start from behind the ear, then head, neck, sore throat. Enlargement of lymph glands. What are the prevention and controls? Vaccination with the combined vaccines for measles, mumps, and rubella is the mainstay of preventions. Vaccinations of childbearing age, 15 to 39 years women to avoid congenital rubella. Pharmacists should emphasize to all pregnant women the possibility of congenital malformations with rubella infections. These are the education which will be provided to the patient and patient's relative. Now come to mumps. It is an acute infection caused by virus that has preference for the glandular and nervous tissues. The main feature of disease is enlargement and tenderness of one or both the parotid gland. It may also affect the pancreas, ovaries, prostate, and central nervous system. Causative agent is myxovirus parotiditis. Mode of transmission is it spreads directly person to person by droplet nuclear infections. Infected person through coughing, sneezing. Tiny droplets will be showing. Contaminated salivas are there. Incubation period is 2 to 3 weeks. And sign and symptoms are fever, headache, swelling, pain in the both glands, one and both glands, earache in children's, pain and stiffness while opening the mouth. Prevention and control. Vaccines should not be administered to pregnant women, patients receiving immunosuppressive therapies, or those who are severely ill. Vaccines with the combined vaccines, measles, mumps, and rubella is the mainstay of preventions. 2 doses in the children's. First is 12 to 15 months, and the second dose will be given to 4 to 6 years. Isolation till the clinical symptoms subside. Disinfect all the articles used by the patient. Now next is influenza, which is also known as flu. It is a highly communicable disease of the upper respiratory tract. It affects people of all ages and both genders, male and female. It is virus-borne acute infectious disease which mainly affect the respiratory tract infection. Causative agent is influenza virus A, B, and C. These are RNA virus and members of orthomyxlovirus family. Mode of transmission is droplet infection, direct contact with the infected person. Source of infection is clinical and subclinical patient of the disease. Now, sign and symptoms is sudden fever, headache, generalized body ache, anorexia, nausea and vomiting, sore throat, pain in throat, nasal congestion, cough. These are undercome in the sign and symptoms. Preventions and control. Isolate the suspected cases. Complete bed rest, antipyretics to maintain normal body temperature, analgesics to relieve pain. In case of any complications such as bronchitis, pneumonia, etc., specific treatment should be given like maintenance of hydration level, maintenance of nutritional level, psychological support. Isolate the patient, appropriate measures should be used to provide transmission of the disease by droplet infection, as this disease is mainly transmitted by droplet nucleus. Avian flu. It is a viral disease caused by avian influenza known as bird flu type A viruses. What are the causative agent? Avian influenza viruses usually infect bird species, commonly wild bird species. Mode of transmission do not normally infect the humans. It is transferred from infected animals to the human beings. by contact with bird feces or secretions. Undercook poultry meat or eggs from infected birds, chickens, ducks, and turkeys. The incubation period of 2 to 7 days. And the sign and symptoms are fever, sore throat, cough, muscle aches, body aches, shortness of breathing. Prevention and control. Well cooked poultry meat and eggs. Protection from the bird feces and secretions. The vaccines, which is known as H1N1 virus, can be transmitted, administered if available. Treatment antiviral drugs, which is known as oseltamivir or zenamivir, will be given. Next is swine flu. Swine flu, it is commonly known as swine flu H1N1, primarily caused by the H1N1 type of influenza A viruses. Positive agent of swine flu is H1N1 virus. It is also known as swine flu influenza or pig influenza. Mode of transmission, a combination of viruses from pigs, birds, and humans causes swine flu in humans, transmitted through a contaminated droplet or contaminated surface to your eyes, nose, or mouth. Human to human transmission by droplet infections. The sign and symptoms are fever, sore throat, cough, body ache, runny nose, headache, fatigue, lethargy, diarrhea, nausea, vomiting. And the prevention and control is flu vaccine. Wash your hands thoroughly and frequently. Cover your mouth while coughing and sneezing. Avoid touching faces. Clean surface. Avoid contact. Treatment, antiviral drugs will be given to the patient. SARS. SARS is a severe acute respiratory syndrome, is a contagious, sometimes fatal respiratory diseases. Positive agent of SARS is a strain of coronavirus. It is also a strain of coronavirus. Mode of transmissions of SARS is it is spread through direct contact or while droplet nuclei. And the sign and symptoms of SARS is flu-like symptoms. Sometimes patient is having body ache, chills, muscle aches, headache, congestion, fever up to 100 Fahrenheit and higher than, dry cough, shortness of breathing, anorexia. Prevention and control. Wash your hands thoroughly and frequently. Wear disposable gloves, surgical mask, wash personal items, avoid touching faces, disinfectants. If you are going outside, avoid to touch your face, eyes especially. And the treatment is antiviral therapies may be helpful to recover the disease. It's depend upon the sign and symptoms. MARS, Middle East Respiratory Syndrome, is a viral disease affecting respiratory system. Causative agent is MARS coronavirus, and mode of transmission is it spreads through droplet nuclei and droplet infections. There are 4 risk groups. Number 1 is senior citizens. Second is patient who is having low immunity, lung disease, kidney disease, or diabetic patients are catches this disease very easily. Area outbreaks, the where Middle East and South Korea are the areas where these disease found. The closer of a person who is sick. The 2 persons who are closer, the one is hospital, healthcare providers, and the second is the chooser, the person who is very close to the patient, is infected very easily. Sign and symptoms. The sign and symptoms are fever, cough, shortness of breathing, muscle pain, diarrhea, abdominal pain, pneumonia, dyspnea, kidney failure. These are the sign and symptoms of MARS. Prevention and control. In MARS, we have to wear the medical mask, eye protections, clean, non-sterile long sleeve gown and sterile gloves. Maintain a hand hygiene. No medicines will be provided. Only for the supportive management will be provided if the patient is having fever. Then we'll give the antipyretic drugs. If the patient is having difficulty in breathing, so we will give the steam inhalation. Now, next is intestinal infections. Intestinal infections. Number one is poliomyelitis. Poliomyelitis is very common. It is also known as a infantile paralysis. It is an acute infectious viral disease of the human alimentary tract, but may affect the central nervous system, resulting in paralysis. The patient's lower limbs are completely paralyzed. It affects all ages, but mostly children below 5 years are more susceptible. Males are affected more than in females. Positive agent is polio virus 1, 2, and 3. Mode of transmissions, it is spread through fecal oral route. Viruses is found in the nasopharyngeal secretions, feces, urine of patients and carriers. Contaminated fingers or indirectly through contaminated water, milk, food are the source. Incubation period is 7 to 21 days. Sign and symptoms. Pre-paralytic symptoms are high fever, headache, chills, diarrhea, pain. These are the pre-paralytic symptoms, and the paralytic symptoms are foot drop, facial paralysis, hand paralysis. These are the paralytic symptoms after paralytic. Preventions and control. Prevention is done by active immunization of all infants and children up to 5 years of age. Oral polio vaccine is given in 3 doses at the age of 1 year and a half months. Second dose will be given to the patient 2.5 months, and the third dose is given 3.5 months. First booster dose is given at 18 months and the second booster dose is given at 5 years of age. The patient should be isolated. Feces, urine and other discharges of the patient should be properly disposed of hygienic conditions. Proper measures for a safe and adequate water supply and sanitary disposal of solid waste should be made. Flies should be destroyed. Avoid overcrowding in schools, other places of gatherings. Overcrowded areas should be avoided to the patient. Hepatitis, viral hepatitis. It is a communicable disease caused by a virus and affect the liver. Viral hepatitis includes hepatitis A and hepatitis B. Viral hepatitis, infectious hepatitis, hepatitis A, serum hepatitis known as hepatitis B virus. Delta hepatitis is also known as hepatitis D. Hepatitis A, it is formerly known as infectious hepatitis. Children are more affected than adults. An attack of hepatitis A generally provides immunity against a second attack. Positive agents, hepatitis A virus is enterovirus. It spreads through the fecal oral route. It may spread from person to person by direct contact through contaminated hands. It can occur by using contaminated food, water, or milk. Rarely transmitted through needles, blood products. Incubation period is 15 to 45 days. And the sign and symptoms is fever, jaundice, light color stool, pain in joints, dark urine, abdominal pain, nausea, loss of appetite, fatigue, generalized weakness, liver enlargement. And the prevention and control of the disease is, first of all, isolate the hepatitis cases. The patient who is suffering from hepatitis should be isolated, disinfecting the feces and fomites of the patient. The chlorine, bleach, and water mixture is recommended for sanitizing stainless steel, food, mouth contact items, tile floors, non-porous surface, counter sinks, and toilets. Mix 1 and 2.3 cups bleach into 1 gallon of water. Follow personal and community hygiene. Anti-fly measures should be taken. Needles and syringe should be properly sterilized. It is advisable to use disposable syringes and needles. Human normal immunoglobulin should be administered to all contacts before or within a week of exposures. Now come to hepatitis B. It is also known as serum hepatitis. It is an acute systemic infection of the liver, sometimes leading to cancer of the liver. It affects all age groups, but is more common in adults than in children. Positive agent is hepatitis B virus. Mode of transmission is parenteral route through infected blood, blood product, blood transfusion, dialysis, contaminated needles, and syringes. Mother to fetus in uterus, transmitted by sexual contact or even kissing. These are the mode of transmissions: tattoos, body piercing, sharing toothbrush, razors, mother to newborn, or homosexuals. Incubation period is 60 to 180 days, and the sign and symptoms are liver enlargement, fatigue, jaundice, nausea, vomiting, generalized weakness, chronic liver diseases which may lead to cancer of the liver. Common sign and symptoms of hepatitis B is fatigue, abdominal pain, loss of appetite, joint pain, jaundice, dark urine, nausea and vomiting. What are the preventions? Avoid blood transfusions and their products which are contaminated with the hepatitis B virus. Use disposable needles and syringes, and always use sterilized instruments for piercing the ear or nose. Give the hepatitis B vaccines by the intramuscular route, 3 doses of 1 ml each. Second dose is given 1 month after the first dose, and third dose is given 5th month after the second dose. Hepatitis B immunoglobulin should be given immediately to the person who are exposed to the hepatitis virus within 24 hours. Cholera. It is a global public health treated and indicated inadequate and lack of social and economic development. Access to safe water, basic sanitizations and hygiene is essential to prevent cholera and other waterborne diseases. Cholera is an acute infectious disease of the intestinal tract. What are the characteristics? The sudden onset of severe diarrhea and vomiting, leading to rapid dehydration, often resulting in death of the patient. It affects all ages, mainly people with poor personal hygiene and environmental hygiene. Causative agent, Vibrio cholerae, and the mode of transmission is fecal oral route, spread by ingestion of contaminated water, food, milk, products, or drink with discharges of the patient by careless handling of fomites of infected persons and not washing hands properly. Flies act as mechanical carriers. The incubation period is 12 hours to 5 days after infection. What are the signs and symptoms? Diarrhea with rice water stool present, and vomiting, cramps in the legs and abdomen, rapid dehydration. Prevention and control. Early detection of suspected cases and bacteriological examination of stools for the confirmations. Notification to the local health authorities that the cases are arises from this areas. A patient may get isolated in the hospital or treatment centers. Disinfectants of stools, vomiters, clothes, bedding, rooms, and utensils. Quarantine for a period of 5 days. If the severity, it's depend upon the severity of the case. If the patient is critical, then they may quarantine themselves. Sanitary measures like water control, fly control, and disposal of excreta. Treatment which involves rehydration of the patient with administration of fluid like ORS, antibiotics, tetracycline. ORS contains sodium chloride, sodium bicarbonate, potassium chloride, and glucose dextrose. Prevention by cholera vaccine. Health education stressing the importance of food, personal hygiene, and water hygiene. In the other hand side, we have to see homemade remedies, ORS. In homemade remedies, we have to take 4 spoon of sugars, pinch of salt in 1 liter of water, and this dissolve all this thing in a water and will provide to the patient for preventing dehydration. Next is typhoid. It is also known as enteric fever, which includes both typhoid and paratyphoid. Typhoid is an acute communicable disease caused by Salmonella typhi and paratyphi. It affects all ages but is more common in 10 to 30 years of age peoples. Positive agents, Salmonella typhi, Salmonella paratyphi, ABC. Mode of transmission. Source of infection are the feces and urine of cases and carriers. Transmitted by contaminated water and food. Also transmitted by contaminated fingers and flies. Poor sanitation, poor hygiene is incubation period is 7 to 28 days, and the sign and symptoms of typhus is early symptoms include like nausea, vomiting, diarrhea, fever, headache. These are the early sign which shows to the patient. Continuous fever 2 to 4 weeks. There is a stepwise increase to the extent of 10 centigrade every day, which is called step ladder fever. Weakness, tiredness, weight loss, poor appetite, shows slow pulse rate. It also shows in the sign. Prevention and control of the disease. Water must be protected from the contaminations with feces, urine, and sewage. A safe drinking water supply should be made available to the public areas. Water and milk should be consumed only after boiling. Human excreta and urine should be disposed in a sanitary way, maintain sanitation in and around the home. All eatable foods should be protected from flies. Raw vegetables and fruit should be washed properly. Anti-fly measures should be taken. The public should be educated about the sanitations and proper personal hygiene. All acute cases should be detected, notified, and isolated at the earliest. All the preventions people should be immunized with the TAB vaccine, which contains S. typhi, S. paratyphi A, and S. paratyphi B. Second dose each of 0.5 ml. TAB stands for typhoid, paratyphoid A and B. Treatment: give complete bed rest. Chloramifrol 15 mg, 1500 mg. It is used to treat serious bacterial infection. 4 times a day will be given to the patient. Give a nourishing diet to the patient. Disinfectant all the articles used by the patient. Now come to food poisoning. Food poisoning is an acute gastroenteritis caused by ingestion of food or drink contaminated either with bacterial, their toxins, inorganic substance, or poisons derived from plants and animals. Food poisoning can be classified by non-bacterial food poisoning or bacterial food poisoning. Causative agent, as I told you, non-bacterial food poisoning and bacterial food poisoning. The non-bacterial food poisoning caused by chemicals, arsenic, cyanide, copper, sulfate, chlorides, fertilizers, pesticides, plants, and seafoods are undergone in non-bacterial food poisoning. And bacterial food poisoning is caused by food contaminated with bacteria or their toxins. The bacteria which can produce food poisoning are Staphylococcus, Clostridium. What are the mode of transmission? Ingestion of food or water contaminated with bacteria or their toxins or chemicals. The incubation period of bacteria are different, like Salmonellas incubation periods is 12 to 24 hours, Staphylococcus is 2 to 4 hours, and botulism is 12 to food poisoning sign and symptoms. The patient is having food poisoning, may feel nausea, vomiting, severe diarrhea, abdominal cramps, high-grade fever, headache, dizziness, continuous vomiting. Prevention and control of the disease. First of all, we have to prepare food prepared from animals and meat should be inspected. Like the animals' meat should not be too old. Personal hygiene and food sanitation should be ensured by food holders. Stored food should be protected from cockroach, flies, rat, dust, etc. Protection and covering of the food during processing and storage. Refrigeration for overnight storage of food should be monitored. Food should be freshly prepared and eaten at the same time. If suspicion, then the food has developed bacteria growth. It must be discarded. Treatment: fluid and electrolytes in dehydration. ORS therapy can be given to the restore the body fluids, and antitoxins must be given in case of botulism. Amoebiasis, also known as amoebic dysentery, it is an infection caused by anti-amoebians infected by the parasites Entamoeba histolytica. It is more common in tropical areas with poor sanitary conditions. Causative agents. The causative agent is amitoamoeba histolytical and entamoeba coli, which is also known as E. coli. Mode of transmission is usually transmitted by the fecal oral route, indirectly transmitted through contact with contaminated hands or objects, food, water, etc. Injection of the cyst from of the parasites. Sign and symptoms: lethargy, loss of weight, colonic ulceration, abdominal pain, diarrhea. Complications are peritonitis, colitis, dehydration, anemia, bloody stool, fever, vomiting. The treatment of amoebiasis is plenty of ORS or fluid intake, antidiarrheal drugs like loperamide, antibiotics will be provided. Preventions and control. Prevent the spread of amoebiasis. Wash your hands thoroughly with soap and water for at least 10 seconds after using the toilet and before handling foods. Clean bathrooms and toilets often. Avoid sharing towels or face washers. Avoid raw vegetables when in endemic areas. Boil water and avoid eating street foods. Treatment of amoebiasis is amoebocidal tissues active agents, luminal cysticidal agents will be used. Now next is acute diarrheal diseases. It is a sudden onset of frequent losses of watery stools, often accompanied by vomiting and fever, usually mild with spontaneous recoveries. Causative agent is bacteria, Salmonella, Vibrio, parahemolyticals. Now the viruses are noroviruses, rotaviruses, sapoviruses, and astroviruses. Mode of transmission is it is transmitted by the fecal oral route, contaminated hands, ingestion of contaminated food, water, ingestion of the cyst from of the parasite. Sign and symptoms are vomiting and diarrhea, frequent loose watery stools, abdominal cramps, abdominal pain, bleeding, headache, fever. Complication is dehydration. If the patient is having vomiting, loose stools, the body needs more fluid. So the complications will be dehydration. Prevention and control. Hand washing with soap and water, access to safe drinking water, use of improved sanitizations, good personal and food hygiene. Health education about the spread of infections should be given to the patient and their family. Rotavirus vaccines should be given. Arthropod-borne diseases. Arthropod-borne diseases are that diseases which may get from the mosquitoes, flies, and other. It is the most important parasitic disease in the world. It is communicable disease caused by the parasitic protozoa, Plasmodium species. It is seen more commonly in the rural areas in comparing to urban areas due to insanitary conditions in the rural areas. What are causative agents? Causative agents are divided from the disease conditions. As the patient is having Plasmodium vivax, the causative is 42-hour cycle, and Plasmodium falciparum is 48-hour cycle. Plasmodium malarii is 72-hour cycle, and Plasmodium ovale is 48-hour cycle. Mode of transmission. Malaria is transmitted by the bite of an infected female Anopheles mosquito. During her lifetime, single mosquito may infect several persons, which is known as vector transmission. Malaria parasite may also be transmitted through infected needles and syringes and by blood transfusions. Incubation period is 12 to 14 days and the sign and symptoms is stage is 15 to 2 hours and the hot stage is 2 to 6 hours. Sweating stage is 2 to 4 hours. Anemia may develop. Liver and spleen may be enlarged. Prevention and control. Do not allow to collect water around the house and the locality. Do not allow the collect the refuse in the dustbins. They should be cleaned regularly and disposed in a sanitary manners. Do not throw the broken earthen pots and other discarded containers, tins, tires, etc. on the roof top because water may collect there which will act as breeding place for mosquitoes, which is very harmful. All drains should be regularly cleaned and spread DTT or BHC. Kerosene oil or may other larvicidals can be spread over stagnant waters. While sleeping in open mosquito nets should be used, mosquito repellents should be used, mosquito-proof clothes should be used to prevent bite of mosquitoes. Health education awareness should be given to the patient, society, hospital areas, and other areas where people don't know how to prevent their self from the disease. Treatment. Chloroquine 600 mg, then followed by 300 mg in hours, then 150 mg twice daily for 3 to 7 days. Chloroquine is the treatment of malaria. Now come to filariasis. Filariasis is a communicable disease which is transmitted through mosquito bites, affecting mainly lymphatic systems. The causative agent is Vulture bancrofti, Brugifmalii, and Brugifti mori. Mode of transmission, it is spread through bites of infective female Culex mosquito. The Culex mosquito sucks the blood of an infected person during the night and transmits the disease. Monsonia mosquitoes transfer B. malai and T. B. timori. It passes through the skin and reaches the lymphatic system. Incubation period is 6 to 18 months and the sign and symptoms is red patches on the skin with inflammation and swelling, fever with shivering, muscle tightness and myalgia, lymphangitis, lymphadenitis, elephantitis of genitals, legs and arms, etc. Treatment of filariasis is the primary treatment for filariasis involve the use of anti-filariasis drugs such as D-ethyl carbimazine, which is known as DEC, and ivermectin and albendazole, which can kill the adult worms or inhibits their reproductions. Symptomatic treatments like patient is having pain, swelling, inflammations, will use analgesic, anti-inflammatory drugs and compassion therapies will be given to the symptomatic treatments and the surgery. In case the patient is severe lymphedema or elephantitis, the surgical interventions may be necessary to remove excessive tissues or improve lymphatic drainage. Now come to dengue. Dengue is a viral disease transmitted to humans through the bite of infected mosquitoes, also known as breakbone fever. This is very common, breakbone fever. The causative agent is dengue viruses, which is known as dengue 1, 2, 3, and 4. Mode of transmission. The primary vectors that transmit the disease are Aedes aegypti mosquitoes and to a lesser extent Aegyptis albopictus. The incubation period is febrile phases 2 to 7 days. And the sign and symptoms, dengue should be suspected when a high fever, 40 centigrade or we can say 104 Fahrenheit is accompanied by two of the following symptoms during the febrile phase, 2 to 7 days, which is severe headache, pain behind the eyes, muscle and joint pains, nausea, vomiting, or swollen glands. The glands may be swollen or rashes. If these signs and symptoms are shown with fever, may suspect from the dengue. Prevention and control. Prevention of mosquito breeding is preventing mosquitoes from assessing egg lining habitats by environmental management and modifications. Disposing of solid waste properly and removing artificial man-made habitats that can hold water. Covering empty and cleaning of domestic water storage containers on a weekly basis. Applying appropriate insecticidals to water storage outdoors container. Prevention and control. Personal protection from mosquito bites. Using of personal household protection measures such as window screen, repellents, coils, vaporizers. These measures must be observed during the day both inside and outside of the home, like workplaces, schools, because the primary mosquitoes vector bites throughout the day. Wearing clothing that minimize skin exposure to mosquitoes is advised. Community engagement, educating the community on the risk of mosquitoes-borne diseases, engaging with the community to improve participations and mobilization for the sustained vector control. Prevention and control. No specific treatment is depend upon the sign and symptoms basis. Supportive care such as fever reducer, painkillers can be given to the control the symptoms of the muscle ache and pain and fevers. Chikungunya. It is a viral disease that is spread to people by the bite of an infected mosquito, mainly Aedes aegyptis and Aedes albopictus. Positive agent is chikungunya virus belonging to the family Togaviridae, genus Alpha virus. The mode of transmission of chikungunya virus is primarily transmitted to the people through the bite of an infected mosquitoes, mainly Aedes aegypti and Aedes albopictus. Blood-borne transmission of chikungunya virus is possible. What are the signs and symptoms? Fever, joint pain. Other symptoms may include headache, muscle pain, joint swelling, or rashes. Death from chikungunya is very rare. Most people feel better within a week. However, joint pain can be severe and disabling and may persist for months. Prevention and control. Preventing mosquitoes from accessing egg lining habitats by environmental engagement and modifications. Disposing of solid waste properly and removing artificial man-made habitats. that can hold, covering, emptying, and cleaning of domestic water storage containers on a weekly basis, applying appropriate insecticidals to water storage outdoor containers. Prevention and control. Personal protection from mosquito bites like wearing full sleeves dresses, screening replicants, coils, vaporizers, wearing clothing that minimizes skin exposures to the mosquito is advised to the patient or kids. Community engagement. The community will engage by educating the community on the risk of mosquito-borne diseases by giving health educations, awareing of these diseases, engaging with the community to improve participations and mobilization for sustained vector controls. Prevention and control are treatment. The prevention and controls are get plenty of rest, drink fluids to prevent dehydration, symptomatic managements. Take medicines such as paracetamol to reduce fever or pain. It's a symptomatic management will be given to the patient. Now come to surface infection. What are the surface infections? Surface infections are those infections which will be provided from the surface area. It is a chronic communicable disease of the conjunctiva and the cornea and causes blindness. The children of both gender are affected more common from this disease, especially living in unhygienic conditions and overcrowded places, may get infected. Positive agents is chlamydia, trachomatis. Mode of transmission is it may transfer from one person to another by direct or indirect contact. Handling towels, handkerchiefs, clothes, surma, kajal, any eye equipment, eye drops are sharing with each other. Swimming pools where water gets contaminated, flies act as mechanical carrier. These are the mode of transmissions which may carry the infection very easily. The incubation period is 5 to 12 days. And the sign and symptoms is inflammation of conjunctiva, inflammation of cornea, epithelial keratitis. Epithelial keratitis is the mucus secretions, pus formation in the eyes, pannus formation. Prevention and control. Early diagnosis and treatment of these cases should be done. Attempts should be made to remove illiteracy, ignorance, poverty, and overcrowding. Health education should be given to parents, children, and students regarding the spread, prevention, and control of trachoma. Common use of eye preparations like towel, handkerchief, eye drops, kajal should be avoided. If the patient is having any eye diseases, any kind of eye diseases, they may not share any eye equipments, eye kajals. Detection in the open should be discouraged. Defecations in the open should be discouraged. Anti-fly measures should be taken. Now come to tetanus. Tetanus is an acute disease caused by the exotoxin of Clostridium tetani. Neonatal tetanus is a major cause of infant mortality in India. Positive agent is Clostridium tetani, a toxin produced by C. tetani. Mode of transmission is tetanus spores enter through contaminated wounds, injuries, or abrasions. Injuries caused by iron articles are the major causes of tetanus. The other causes of tetanus include pin pricking, abrasions, wound, burns, human bite, animal bite, stings, use of unsterile injectable needles and syringes may cause tetanus. Incubation period is 3 to 21 days, and the sign and symptoms is irritability, restlessness, fever, spasm of neck muscles, spasm of muscles of the jaw, which is known as lockjaw, spasm of facial muscles. Prevention and control. Prevented by active immunization with tetanus toxoid, which is known as TT. Infants and children are best immunized by giving DPT vaccines, which is 3 doses of 0.5 ml each doses. Pregnant women should be given tetanus toxoid doses as a routine to prevent neonatal tetanuses by 2 doses. Complete sterility precautions should be taken during childbirth. All wounds should be thoroughly cleaned and long-acting penicillin should be administered. The patient should be given muscle relaxant and sedatives. The patient with wound can be given anti-tetanus serums and human tetanus immunoglobulins. Leprosy. It is also known as Hansen disease. Leprosy is a chronic communicable infectious disease caused by Mycobacterium leprae. It affects mainly the peripheral nerves. It also affects the skin, muscle, eyes, bones, and internal organs. Positive agent is Mycobacterium leprae. Mode of transmission is prolonged skin contact with infected person, either directly or indirectly through vomitize. Droplet escape from cutaneous lesions, nasals, and sputum secretions to the infants to the mother's milk. If the mother is having leprosy, so the child may suffer. Incubation period is 6 months to 8 years, and the sign and symptoms is appearance of small patches on skin that is dark in color. Skin of the face become thick and wrinkled. Partial or total loss of cutaneous sensations in the affected areas. Presence of leprosy in skin or nasal. Deformities of hand and feet. In the last stage, the deformity of hand and feet will be shown. Prevention, continuation. Cases of leprosy should be notified. Patients should be isolated after some time. Detection of cases of leprosy and separate the contacts, especially through the children's. Infants should be separated at birth from lepromatous patients. Patients' cloth discharges should be disinfected. People should be given health education by preventing, by isolating, by other measurements. And treatment is multi-drug therapies, dapsone, rifampicillin, and chlorphazimine will be given. Now, the last one is sexually transmitted diseases. In STD, the first disease will come is syphilis. Syphilis is sexually transmitted disease caused by Treponema pallidum. Syphilis are 2 types. First is acquired and second is congenital. Positive agent is Treponema pallidum. Mode of transmission is acquired syphilis is spread through sexual intercourse. Congenital syphilis is transmitted from the infected mother to child through placenta. That's why it's called congenital syphilis. Syphilis may also spread through infected towels, kissing, close contact with the person. Incubation period is 10 days to 10 weeks. And the sign and symptoms, early syphilis is canker with hard and painless in the penis or vulva. Secondary syphilis, enlargement of glands, headache, sore throat, low fever, and the tertiary syphilis shown, it will appear after 5 years of infection. In this stage, it can affect bone, skin, tongue, taste, liver, heart, etc. So the sign and symptoms is divided into 3 stages: early stages, secondary syphilis stages, and tertiary syphilis stages. Prevention and control. Early detection of syphilis cases and tracing the contact by limiting the sexual partners, by using condom during sexual intercourses. Prostitute should be examined medically for STDs from time to time. Health education about STD and its problem. Treatment will be given is proclaim penicillin 6,000 units IM as a single dose. Next is gonorrhea. Gonorrhea is an acute infectious venereal disease caused by Neisseria gonococcus. It affects mainly mucous membrane of urethra, rectal, mucosal, and conjunctiva. It occurs in 2 stages. First is acute stage and the chronic stage. Causative agent is Neisseria gonococcus, which is also known as gram-negative diplococcus. Mode of transmission is it is transmitted through sexual intercourse with an infected partner. In certain cases, it may also spread through infected towels, clothes, brushes, razors, etc. Incubation period is 3 to 10 days. And the sign and symptoms is acute stage. In acute stage, inflammation of urethral in males, inflammation of the cervix and vaginal of the females, burning sensation with pain while passing the urine. Chronic stage is inflammation of big joints like shoulder joint, knee joints, wrist and ankle. Early detection of gonorrhea causes and tracing the contact by limiting the sexual partners, by using condom during sexual intercourse, and health education about STD and its problem. The treatment is same, proclaim penicillin 6,000 units IM for 10 days. Now come to AIDS. It is also known as slim disease. It is a sexually transmitted disease caused by retrovirus known as human immunodeficiency virus. HIV attacks the WBC, which makes our immune system weaken. So persons suffering from AIDS become easy target for other infectious diseases. Just because their immunity power is very low, so they can catch the diseases very easily. The causative agent is human immunodeficiency virus, which is also known as retrovirus. And the mode of transmission is sexual contact like vaginal, oral, or anal sex. Through transmission of blood infected with HIV virus, through contaminated needles and syringes, infected mother to the fetus through placenta. Incubation period is 10 years and the sign and symptoms is weight loss, fever or night sweating for longer than 1 month, chronic diarrhea more than 1 month, swelling in the gorions, persistent cough. The patient is having persistent cough. The prevention and control is have only one uninfected sexual partner and do not indulge in multiple sex partners. Avoid going to prostitutes for sexual intercourse. Use condom during sexual intercourses. Properly sterilizing the needles and syringes. Women who are suffering from AIDS should avoid pregnancy. Blood and products should be thoroughly investigated for the absence of HIV infections. Hair cutting salons should ensure that barber's razor is properly cleaned or they should use new blades. Health education regarding the STD. That will be all. Thank you. Related to the communicable diseases, any queries, kindly ask.
Participants can ask any questions regarding the topic. Anyone want to ask your questions? Chat box is yours.
Hope you people understand about the communicable diseases, their management, their treatment.
I think there is no questions.
Okay.
Thank you, ma'am.
Thank you, sir.
Thank you, ma'am, for the today's topic. I really welcome you and thank you for the today's webinar series. I hope really students engaging on the topic. Next, we will meet you again in the future. Participants, next Zoom meeting or webinar series is tomorrow. Hope you find knowledge